Yeah, I cannot emphasize enough how important it is to have a multidisciplinary team for neuroendocrine tumors. You know, you have to have a net-focused pathologist to review the slides of these patients, because they often, the diagnosis can change slightly. When we have a pathologist reviewing that specializes in neuroendocrine tumors. Then you have to have good radiologists helping you to read the films. Then you have to have your surgeon or your surgical oncologist looking and evaluating this patient with you, because even in the setting of stage 4 disease or metastatic disease, we can still offer surgery to these patients in many occasions, and the surgeons can be even with, in a way, curative intent in putting the patients on remission for a very long time, or it can be offered to improve the quality of life, because some of these patients are so symptomatic that debulking their disease can make wonders for the quality of life. We also have to have a nuclear medicine physician with us, because now with the upcoming use of PRT, you know, our colleagues from nuclear medicine are extremely essential for the treatment of neuroendocrine tumors. We have to have our help of our endocrinologists to help with some of the issues that come with having a NET patient. And I haven't even mentioned the fact that we need the help of the gastroenterologist to diagnose this disease that sometimes we often have to do two endoscopy procedures, but also to help in managing some of the most challenging issues of these patients, including the diarrhea, for example. So these are just few examples of how a patient with neuroendocrine tumors should be taken care of by a multidisciplinary team. So it's very important to educate patients and their families in terms of the new diagnosis of neuroendocrine tumors. So when the patient comes to the clinic to me, I typically explain what a neuroendocrine tumor is. I try to make the comparison, you know, to some extent. I compare the Steve Jobs' pancreatic cancer versus the Patrick Swayze pancreatic cancer. That gives an initial, sort of visual understanding of the difference between both diseases. I try to explain the natural history of the disease as much as the capability of the patient to understand differences. And then I also redirect patients to reliable sources of information that we have in the internet from the different net organizations that we have. We have the Carcinoid Foundation, we have the Healing Net Foundation, the NetRF Foundation also has some information for patients. I think all this is very important. There is also amazing supportive group organizations out there that are extremely reliable and supportive to patients, so I tend to direct my patients to this type of organizations as well.